breathe. Everyone take a
We
deep
start
breath.
out on. Okay.
Okay. The country we chose is Vietnam. Our country and our major health problems. The major health problem that Vietnam faces are strokes and cardiovascular disease and heart disease, which is a coronary artery disease.
Vietnam is located in Southeast Asia. It has a population of about 101.6 million people as of 2025. The median age is about 33 years old. Roughly 41% of the population live in urban areas, and the life expectancy in Vietnam is about 75 years old. And this is where you would find Vietnam on the map.
Burden of disease. So basically what burden of disease is how prevalent cardiovascular diseases are in Vietnam. The percentage, like shown in the graph, is about 31%, shortly followed by cancer as the second leading cause of death. The reason we chose cardiovascular disease is, like it shows, it is the leading cause of death. Examples of cardiovascular disease, like we are going to talk about, are strokes, coronary artery disease, which is a type of heart disease, and heart failure. So some geographical contributions to this health issue, since it is a non-communicable disease, which means it just can't be transferred from person to person, air pollution is probably the most significant risk to civilians' health when it comes to stroke or heart disease. There are quite a few contributions when it comes to air pollution. So like carbon monoxide, nitroxide, sulfur oxide, or multi-organic compounds. These come from different production fields such as thermoelectric, industrial, and probably the greatest by far when it comes to carbon monoxide, which is more commonly associated with these kind of problems, transportation. So you're going to see this in buses, cars, airplanes, anything that really emit gases. Another geographical contribution is found within the socioeconomic and environmental differences between urban and rural areas. It was found in an article that was conducted. People with CVD are more prevalent within the ages of 15 to 59 in urban areas by about 30%. However, in urban areas as well, it is decreased by about 51% for those above the age of 60 compared to rural counterparts.
Now we will talk about the historical impact. During 1986, the Doi Moi reforms, this is a set of political reforms that helped the country by central economy to socialist economy. This helped with the economic growth and reduced the poverty while maintaining the education and food resources needed to survive. Later then was introduced the health challenges such as cardiovascular disease, which is what we've been talking about, and the legacy of preventative medicines came soon after that, which is when, after the war, Vietnam focused more on their public health models. This is vital for Vietnam because it helped the people focus on vaccinations, hygiene, and childcare, creating a stronger public health response, because in order for us to prevent these things, we need to catch them early on. And then we will talk about the major health priority. So the strengthening universal coverage, they've reached their goal of 95% by 2025. They continue to expand the access to the growing population with low-income groups, like ethnic groups, minorities, or single mothers, and remote communities. Then expanding the preventative and community-based healthcare. Their focus is on preventative medicine on a national policy. They're prioritizing disease prevention with early detection, like I talked about earlier, with the public awareness for their people's benefits. And then the digital transformation of their healthcare by using things such as digital records and management helps spread more awareness for mobile health apps and digital monitoring tools, which helps keep the data and patient management more accessible. This helps balance urban and rural healthcare disparities and addresses the unequal distribution where urban places have many and remote areas are understaffed and don't have enough resources to give the high quality that their patients deserve. And to summarize this slide, it talks about how the Vietnam helps prioritize the universal access, the preventative care, and then the digital monitorization.
Now we are going to talk about the policy context in Vietnam. Vietnam started to prioritize the national recognition of NCDs and recognize that it is a major health threat. They started promoting healthy lifestyle changes that could benefit these people, and there are universal health coverage and social health insurance reforms, which are controlled by Vietnam Social Security. We have World Health Organization Global Action Plan for NCDs. This provided policies for the prevention of cardiovascular diseases, and the picture that you see there is the Minister of the Ministry of Health. So the Ministry of Health is involved with non-communicable diseases overall. They develop the policies and programs for prevention and the management of these diseases. They have control over the hospitals, pharmacies, and medical devices that are used in cardiology. The Vietnam National Heart Institute, it works under the Ministry of Health and is best at the diagnosis, treatment, and research on heart disease. And it also works with other countries in regards to the technology. We have the Vietnam Social Security. They focus on the finances of cardiac care through the national health insurance coverage. We have the Vietnam Health Foundation, which created a national charity fund that supported and covered health-related treatment for patients that have low incomes. And finally, we have the Vietnam Red Cross Society, and they also help promote healthy lifestyle changes that can reduce the risk of cardiovascular diseases.
So what exactly has been done to address these health issues? So the first thing I'm going to talk about is the expanding of universal health coverage. Quite a few countries actually withhold universal health coverage, and basically what it does is it just makes health coverage more accessible for those who aren't as well off. So the government is making this a priority, especially to make it available for, like I said, all those citizens, especially to make it more affordable. One of the ways they did this was by enacting the Law of Social Health Insurance back in 2008, which expanded that coverage for those who really were in need of health care, especially within something that might not be so accessible for those who might not be well off. This insurance coverage was increased to 95%, like it was mentioned earlier, in 2025, which was expanded from its original 62%. This has created a lot more fewer financial issues within families to really allow for that equal care. Another thing they did was they strengthening of the root and community health systems. So basically, one of the ways they do this is by strengthening their four-tier system, health system, which includes the commune level, district level, provincial level, and central level. The purpose of these is to really build a strong primary care that allows for health promotions and early care. So what exactly is the four-tier health system? So like I said, there are 4 tiers that focus on the 3 different types of care. So the first tier is the commune level. This is what really targets those who aren't as well off and might not make income enough to get treatment or early onset treatment for cardiovascular diseases such as heart disease or stroke. But they focus on the primary care, which includes preventative medicine, health and education, maternal and child health, and managing chronic conditions. One of the best ways to prevent non-communicable disease is to just gain awareness of how to prevent it. Next is the district level. The district level is a more better equipped primary, secondary level, and they very similar, but they hold a broader range of common illnesses and injuries. Next is the provincial level. So they are primarily secondary level, secondary care, which they offer specialized outpatient services, diagnostics, and inpatient treatments. So this is also found that hospitals often have advanced technology that might not be available for those who are as well off. And then lastly is the central level. So the central level is primarily tertiary care, and within this system you'll find the central level focuses on high level specialized care, handling advanced procedures, advanced diagnostics, and having those specialized in certain treatments.
So to wrap up, cardiovascular disease and coronary artery disease are major health issues that are impacting the citizens and the healthcare in Vietnam. Though there are still challenges when it comes to prevention and raising awareness, Vietnam has made progress addressing what needs to be changed and altered, implementing strategies, and enhancing health insurance coverage. In order for non-communicable diseases to not pose a threat to the health of Vietnam, involvement from all parties and organizations is necessary. And these are the references that we used for our slides.
I think we are short.